Good day, sir. We will be discussing another topic today, which is the cerebral palsy. And now, what is cerebral palsy? Cerebral palsy, from the word cerebral, which means having to do with the brain, and palsy, which means weakness or problems with using the muscles, is a group of disorders that affect a person's ability to move and maintain balance and posture. It is the most common motor disability in childhood. It is caused by abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. It happens when the brain can't properly send messages to muscles about how to move in smooth or well coordinated ways. CP can also affect other body functions that involve motor skills and muscles, like breathing, bladder and bowel control, eating, and talking. Symptoms of cerebral palsy vary from person to person. A person with severe case of it might need to use special equipment to be able to walk, or might not be able to walk at all and might needing lifelong care. A person with mild cerebral palsy, on the other hand, might walk a little awkwardly but might not need any special help. This does not get worse over time, though the exact symptoms can change over a person's lifetime. Stiff muscles and exaggerated reflexes, spasticity, the most common movement disorder, and variation in muscle tone, which as being either too stiff or too floppy. Stiff muscles with normal reflexes, rigidity, and lack of balance and muscle coordination, ataxia. Tremors or jerky involuntary movements, slow writhing movements. For speech and eating, delays in speech development, difficulty speaking, difficulty with sucking, chewing, or eating, delays in reaching motor skills milestones such as sitting up or crawling, intellectual disabilities, delayed growth resulting in smaller size than would be expected. Other problems damage to the brain can contribute to other neurological problems such as seizures, epilepsy, difficulty hearing, problems with vision and abnormal eye movements, bladder and bowel problems, including constipation and urinary continence, mental health conditions such as emotional disorders and behavioral problems. The brain disorder causing cerebral palsy doesn't change with time, so the symptoms usually don't worsen with age. However, as a child gets older, some symptoms might become a more or less apparent, and muscle shortening and muscle rigidity can worsen if not treated aggressively. There are different types of cerebral palsy. Some people have one type or a mix of. Number one is spastic cerebral palsy, which causes stiffness and trouble moving. Number two is dyskinetic athetoid cerebral palsy, which causes uncontrolled movements. Number three is ataxic cerebral palsy, which causes a problem with balance and depth perception, judging the distance between two objects. Now, how is this treated? There's no cure for cerebral palsy, but resources and therapies can help kids grow and develop to their greatest potential. Number one, treatment that may involve medicine or surgery. Number two, therapy including physical therapy, occupational therapy, and speech therapy. Number three, special equipment to help kids get around and communicate with others. As soon as CP is diagnosed, a child can begin therapy for movement and other areas that need help, such as learning speech, hearing, and social and emotional development. And that will be all. Thank you.